Welcome to the Functional Nurse Podcast, where we explore how nurses are transforming healthcare through functional medicine and nurse-led innovation. I'm your host, Brigitte Sager, founder of the Institute for Functional Nursing. Here, we're reclaiming our role as healers and leaders, one root cause conversation at a time. Hello, and welcome to this episode of the Functional Nurse Podcast. If you have been with me here for a minute, you know that I like to do a little bit of a recap of the conferences that I go to. I think it's really important being in the role that I am with a lot of responsibility for staying current on what's happening in the functional healthcare space and what are things that I'm taking away from the conferences and education that I'm gaining, and how that applies to nursing, translating into like, what does this mean for our practice and what does it mean for my students? So every year I go to the PLMI Thought Leaders Consortium, and it was previously in Seattle last year, and this past week it was in Dana Point, California, which is a really lovely location. If you're not familiar with PLMI, this is Dr. Bland. Some people call him the father of functional medicine. Some people call him the grandfather of functional medicine now. I don't know if that's just like based on age or somebody stepped into the father role. I'm not certain about that. I should ask somebody. He is really incredible at coming up with these speaker lineups for his conferences. I've encouraged a lot of my students recently, if you haven't, you can become a member of PLMI for, I believe it's $199 a year. And I highly recommend it because you get access to literally all the conferences that he puts on and webinars throughout the year with like the best speakers. You get all those for free. So even this conference that I'm going to speak about now, in I imagine a few weeks to a month, it will be available inside that membership where you can access those recordings for the whole year. You can look back on the ones from the previous years that I've spoken about, as well as a whole bunch of other ones. So I think that it's a really great price for a ton of valuable tools and a lot of videos that are super insightful for us. So I'm going to give you some of my takeaways. Obviously, it was like 2 days jam-packed with incredible speakers. The lineup was incredible. So I'm not going to I can't tell you everything everybody said, but some of the things that really stood out to me that I feel like apply to the nurse's role in functional healthcare. So the first speaker was Dr. Bland, and he was kind of introducing the topic, and there was a lot of talk about immunometabolism, which hopefully makes a little bit more sense by the end of this talk if you're not familiar with that term. But one of the things that he mentioned that I wanted to share with you when he was speaking was specifically about like all these different tools that we can use to measure immunometabolic fitness and the significance of that. And so I made notes while I was listening, and I wanted to list off some of the tools that he felt like if you really look at all of these factors, they can give you a pretty good indicator of somebody's immune and metabolic health. It included things like waist to hip ratio, grip strength, their daily steps, average nightly heart rate, average temperature while they're sleeping, average respiratory rate during sleeping, average heart rate variability during sleep, which I did a recent episode on if you're curious about that, average blood pressure, the MMSE, it's a mental health screening, a short tool, and then the Beck depression inventory, felt states compared to biomarker patterns. And this is really, if you're not familiar with that, those two terms. So it's like, how does the patient feel about their health? Like, I heard a thing recently that said, if you think that your stress could harm your health, it was a study that said, if you think that your stress could harm your health, then it tends to have an impact on your health. But if you don't feel that your stress can harm your health, then it is less likely to harm your health. And so this is similar where, how the patient actually feels about their health plays a role in their immunometabolic health. Fecal calprotectin, to get a little bit more specific, so that's in stool testing, their melatonin levels, and immunometabolism overall. So one of the things that stood out to me from this list is like, this is all like maybe stool testing, no, right? So we have one on this list that isn't within the scope of a registered nurse. And just like how many of these are measurable with really inexpensive tools, or I'm going to talk a little bit more about wearables today. And just the idea that like a lot of these are things that your patients can be monitoring over time at home and evaluating their progress as they work on their health goals. There was one thing that I don't super want to talk about this, but I feel like I have to. I try to stay out of these type of topics, but it came up at this conference and I guess I was kind of bummed. I don't know. So some political stuff came up and the whole topic that has been in the news a lot lately around autism, acetaminophen or Tylenol use, vaccines, and the image of functional medicine. And it got a little bit emotional for several of the speakers. And even when we had our open Q&A, it kind of shifted that too, where it's usually this like Thought Leaders Consortium where we're talking about like the future of functional medicine and advances in research that can inform our practice. Instead, it was a little bit different. It was political and emotional in a different way than it has been before. And I still don't fully know how I feel about that, but what I will say about it is regardless of where you stand on the issue, I think that one thing that has come up for me is the way that things are being addressed isn't necessarily giving functional medicine a good name. And we're already like still on the outskirts of respect in healthcare, right? Like we know if you truly understand what functional medicine is about, it's about a root cause approach. It's about really figuring out the why for that person and optimizing their health and wellness. I feel like if somebody truly understands that, how could they not think that's a great idea and a great thing to offer our patients? But a lot of people don't understand what functional medicine truly is. And so if we aren't careful in how we speak about it, or present it to the world, I feel like that can compromise its integrity or how it is viewed by others. And so I feel like that is unfortunate that a lot of the topics that have come up recently might be relevant, right? Things that we should dig into and explore, but maybe in a way that I don't know. I just feel like the one thing that really stood out to me that I think is important to keep in mind is like how many mothers currently are beating themselves up about using Tylenol during pregnancy, and how much trust has been eroded between providers and patients because of the way that these topics have been brought up? And I think that it's just eroding trust in providers overall, and that's already been a problem in healthcare. I think that these are things that we definitely need to draw some better conclusions about and make more informed guidelines around. But I think it should be talked about in a way that still preserves the integrity of like the patient provider relationship. And, just personally, I've just encountered a lot of mothers recently that are questioning choices they made during their pregnancy and caring for their children and also questioning whether their provider gave them useful information and safe information and maybe caused harm. And I wish that it was handled a little bit differently. That being said, I think that that was kind of the vibe of the conference as well, that it came up and it kind of changed the tone. Robert Lustig he spoke during the conference and he gave a really wonderful talk. And he also mentioned a podcast that he was recently on that spoke to a lot of the topics that came up during the conference. So I'm going to link that in the show notes here if you want to go listen to that. It's really long, but I listened to it and it was really insightful. So that is one thing that you could do if you want to explore that topic further. Of course, at the PLMI conference, there's always talks about epigenetics and gene variations and like how we're going to personalize care moving forward. And more research is coming out that kind of informs how we can use all of that and apply it to each patient. There's more and more testing coming out. So I feel like, I've been saying that more and more the last few years that like, we're getting more research guiding how we can inform our patients and apply that in practice. And I think that's going to continue. If you're really curious about that topic or personalized healthcare, then I would definitely recommend signing up for his membership so you can listen to all the talks because they all had some variation on that topic. Around the wearables. So Carrie Jones, you may know, is hormone queen. She's been on the podcast before. She was talking about hormones, and her case study even included the use of a continuous glucose monitor to help guide her patient in making some healthy changes. So the wearable thing like was a theme in many of the talks. Dr. Brigitte Briggs is a hormone expert also. And so she was speaking specifically really about using wearables and these devices that our patients already have and having them inform care. She really touched on that theme that, like, a lot of these labs are really expensive and cost prohibitive, and if you're working particularly in an insurance model, or if you're using Medicare and like, your patients are maybe not gonna be able to access a lot of these labs that we would like to have. So she just talked about how useful a lot of these things are that they may already own. And so if you have patients that are wearing, smart rings and smartwatches and smartphones and all these types of gadgets, that there's so much data that we can get from them. And in particular highlighted she's wearing a Garmin watch now. She's been comparing that to some of her other devices. And so she posed the question, like, if your patient is like hesitant to get a sleep study, or it's booked out for months for them to get a sleep study, or it's not affordable for them to get done, just ask, like, what is your I see you have an Apple Watch on, or I see that you're wearing an Aura ring. What does that show? And can we look at that and watch it over time? That was a big topic for her. And I think it's really valid. I think it's interesting how she tied it into like the whole hormone talk, right? And just like having our patients have more awareness. One thing that came up a lot too was just like, unfortunately, that, like, toxins are ubiquitous. They're everywhere. They're not going anywhere. Not the funnest topic at all, but of course we wanna avoid them. How do we set our bodies up for success knowing that they're everywhere and they're not going away? And there was talk of, like, how do we really approach this with our patients? And if you've taken any of my courses, one of the big things is just making sure that people are capable of detox, that phase 3 is fired up, that they are peeing, pooping, and sweating. Like, just really foundational things can really help to move the needle with this reality that we are living in a pretty toxic environment. So, one talk that I really enjoyed was Dr. Chris Migretta and Eric Lundquist. They did a talk together, and they were inspired by a talk that Dr. Bland gave last year on immune health and did a deeper dive. They just kind of went down this super big rabbit hole. They were creating a course on some lab work stuff for a company, and one of the modules ended up turning into this whole thing about using CBCs. And they're like, wait a minute, Dr. Bland did a talk on that last year. And when they went back and re-listened to it, it sent them down this rabbit hole. And my favorite quote from the conference is, the best predictor of longevity is the biological age of your immune system. Then you have to ask, like, how do you evaluate the immune system? To some degree, the things I named off at the beginning of this talk that Dr. Bland highlighted, they help you to evaluate the immune system. Obviously, a CBC is evaluating the immune system. But there are two ratios that they really, I mean, it was an hour-long talk about these two ratios. So they found them to be really useful, and they're hoping that practitioners will start playing around with them and seeing how they might be useful in their practice. So this is a very novel idea, but the title of their talk was Systemic Inflammatory Index, a New View of an Old Test, the Simple CBC. And I think the big take home from the whole thing is like, a CBC cash pay is a couple dollars. Like, it's an extremely affordable test, but it's generally covered by a patient's insurance if they have insurance. Also, a lot of our patients already have this information when they come to work with us, and so a CBC is frequently something that your patient is giving you on day 1 or before their first visit. So the two tests that I'm gonna just very briefly touch on, because you can go down your own rabbit hole for these, are Systemic Immune Inflammatory Index, SII, and Systemic Inflammatory Response Index, SIRI. And SII has been around for a while, but SIRI is a little bit of a newer concept. SII is a formula where you do platelets times neutrophils divided by lymphocytes. I'll say it again just because in case anybody's writing this down. So SII is platelets times neutrophils divided by lymphocytes. SIRI is neutrophils times monocytes divided by lymphocytes. So SIRI is neutrophils times monocytes divided by lymphocytes. And so these ratios are really affordable ways to kind of track our patients' immune health and follow these numbers and see if they're in a concerning level where it might indicate that we want to dig deeper. So it's just another tool that we can use if you're really curious about like the levels and all those. I encourage you to buy the recordings or join the membership so you can see the recordings, because they share a lot about how these ratios have been applied in their own practice. And this is a really novel idea. So I did a quick PubMed search, and there are some studies out in the last few years on these two, SII and SIRI. So you can go and do your own PubMed rabbit hole adventure if you'd like to on this topic, but really affordable way for us to evaluate our patient's immune health, but also track it over time, because that we could watch that ratio improve or worsen over time as well. And now a quick word about our sponsor, the Institute for Functional Nursing. IFN is the leading education and community platform for nurses bringing functional medicine into their practice. IFN offers everything from short, on-demand contact hour courses to the full functional nursing program, designed specifically for nurses and nurse practitioners ready to practice root cause, whole person care. If you're looking for connection and real-time learning, the Functional Nursing membership includes 4 live meetings every month where we cover case studies and have open discussions and connection. Come be a part of a movement that's redefining what it means to be a nurse. Visit fxnursing.com to learn more and join us. And now back to today's episode. So Dr. Bredesen, I'm really fortunate to get to hear him speak. He presented some recent research and kind of outcomes for different interventions for cognitive decline overall, and found that the functional medicine approach is truly like the most effective thing for reversing cognitive decline. Of course, he has his own program where he teaches that concept. And I noticed in his last few talks that I've been to, he now says, Alzheimer's is now optional. It's not a question. It is optional. And so the approach that we take in functional healthcare to optimize our patients' outcomes and address their health concerns can truly make this something that is an option instead of their destiny. I think the prevalence of Alzheimer's and dementia overall, cognitive impairment, has just rapidly increased over the last several decades. And the fact that we can play a big role in helping patients reduce their risk is just really lovely, really inspiring to hear him talk. And so I'm going to talk in a minute a little bit more about a topic that ties back to him. But another thing I wanted to mention about a theme in the whole conference was this shift that I've noticed, and I've noticed it more and more the last few conferences I've been to. A lot of I've started saying functional health because I want to acknowledge that occupational therapists can use this, pharmacists can use this, chiropractors, nurses, physicians. And so it isn't medicine always, right? Medicine is its own specialty. And we have functional nursing. So functional healthcare is just this overarching idea. And in historically, I feel like, and one of the reasons that we even ever started that conversation about saying functional nursing instead of functional medicine is that it isn't all about medicine. It isn't prescriptions and surgeries. And a lot of it is truly holistic nursing. But I have noticed in the last few years, a lot of the conferences will sprinkle in more and more that prescriptions might be used. I've heard more about metformin and longevity, where it used to be in functional medicine, we were talking about metformin depleting B12. We were talking about if your patient is taking these things, here's the nutrients that are depleted. And then it turned into, well, actually, when we look at research, we see that, there are some benefits. And so you have to take that on a case by case basis. Like, does this person have a high risk for this? And then therefore, would it be worth it to consider this prescription? I've talked recently a lot with students and in episodes about the GLP-1 agonists. They're here to stay. That was a big topic for Dr. Bland at his last conference I attended, was they're here to stay. They're going to become more prevalent. And so how do we acknowledge them in our own practice? Where do they fit? How can we support patients that are on them so that it's not just like they went home? And I had a talk with a bunch of students about this last week, they're just getting sent home with them, right? Here's your prescription. And instead, if we could have a model where, in particular, nurses are supporting patients with the education around, muscle wasting and how to maybe tweak their nutrition and activity while they're on these medications to optimize their outcomes. But so not to sidetrack with that too much, just to say, I'm noticing more and more conversations about the fact that prescriptions are part of the patient's plan of care frequently. Sometimes they might be the right choice for somebody. And so then how do we take that knowledge and what we know about these medications and what we know about maybe the risks associated with them that we can help mitigate if we provide some education or recommend a supplement to go along with it, maybe like in the case of metformin. So that came up quite a bit. And the one that I thought was really interesting is Dr. Briggs just really briefly touched on how she has used GLP-1 agonists. And mind you, she's a hormone expert. Like that's always kind of the theme of what she talks on. But she used it for reducing inflammation in patients and even spoke about it reducing brain inflammation. And so that's kind of how I just thought to mention it from talking about Dr. Bredesen is that it kind of tied back when he brought that up, is that, yeah, I mean, like even what Dr. Briggs was doing with her case study, GLP-1 agonists can help reduce brain inflammation and improve patient outcomes. So we're looking at it from this like risk for developing dementia or depression, so you can go down a lot of rabbit holes and there are more and more studies coming out showing benefit to patients being on these medications. That doesn't mean that they're always the right choice. There's still the why, right? Like we always talk about is like there's the why behind that. Why did this patient even need this in the first place? Where is this inflammation coming from? How can we address that? Is the medication the right choice? Like, can we figure out the root cause and go upstream and focus on our 5 Rs and in particular remove? So the last thing that I wanted to talk about is going back to Dr. Bredesen, the first day, Dr. Bland was really talking about this idea of being a disruptor. And I think it's the biggest thing that I took away from the conference is that we're already disruptors, right? If we are approaching healthcare from a different lens than the allopathic one that a lot of us have worked in most of our careers, we're already considered a disruptor. And that being a disruptor can sometimes make you not that popular, to put it lightly, I guess, and he was talking about Dr. Hyman and, that he's been a disruptor in healthcare and that if nothing else, that is always propelling the conversation forward and maybe bringing up difficult conversations or having people look at things that are like currently the status quo and how that is how we're going to move the needle in healthcare is to continue to be disruptors. And he was like, everybody in this room is a disruptor. I mean, I definitely feel like I am one, I don't have any problem with like asking why. And, maybe that's like the functional approach, right? To ask why for everything and question how things are handled and how we could do things differently and better. But he was talking too about like what that did to Dr. Bredesen's career and how, in his field for a long time, he was, the odd man out and like his ideas were too new and people weren't ready to accept them. And how that has evolved over time, but still, I mean, there's still a stigma for him, despite the fact that he is doing such incredible work to help patients that have this devastating health concern with anything cognitive decline related is just like a massive impact on people's quality of life and their families. And so I think like it's almost like you have to accept the fact that if you're going to be a part of this functional health space, like, you are a disruptor. And one thing that I've noticed, and I've mentioned this recently in episodes, is like from the first cohort of ever teaching functional medicine to now, like over 1,000 nurses and nurse practitioners later, it was like definitely super taboo and very few people in most of my students' communities knew what it was. And people thought they were weird and they weren't comfortable talking about it. And we do like work in the course around that and talking about like, are you having these conversations and how's that going? Or how do you need to talk about it in your sphere, your world for it to like be acceptable, or maybe you can't. And that has definitely evolved to where like now I feel like a lot of my students tell me that people around them are really excited about it. And there's several clinics in their community and they're all super booked out. And that whole demand topic I've brought up a lot lately, like we need nurses in there to help address those long wait lists and onboard patients, running groups, all those things. But back to the disruptor thing, is just like, it's interesting to see, to have been around this long enough to see how this has evolved to where being a disruptor, everybody that has participated in that is like, thousands of nurses moving into this space has really moved the needle in healthcare. And I think that it all feels in a lot of ways, like, really exciting about functional medicine at large or functional healthcare at large at this point. Like, people are wanting it and they're getting really great results from working with somebody that takes a true root cause approach, but also that, like, it's been worth it to, like, be the odd man out and maybe, have dealt with maybe, like, people not respecting you as much as they did in your previous roles. I've definitely experienced that myself, but that they're catching up with us. And now, I used to tell my students a lot, like, we're paving the way, right? And now, I mean, it's true now. Nurses are coming behind us and we're like, "Oh, welcome. We know what this is like and here's where we're at and here's where we're going and how do you wanna step into that space with us?" So, I really liked that theme, just acknowledging that, like, it isn't always easy to be a disruptor, to be part of this team of people that are trying to do something different in healthcare and offer something better to our patients. So, I always, I saw Dr. Bland after the next morning when we were leaving for him ride home as a joke because he doesn't live too far from me. But just thanking him, it's always an honor to get to go to that conference and benefit from the hard work that he does to organize all of this and bring together all these incredible speakers. So if you are able to access those recordings, I encourage you. If you're able to attend one of those in the future, I encourage you to do that too. They're always worth it. I think the next one's in Chicago in the spring, but he also has webinars through the year too. So, okay, so that is everything that I wanted to mention from the conference. If you aren't already aware, we have our summit November 4th through 6th, and that is going to be free. You just go to fxnursing.com. You can sign up for free. And we have 15 presentations. It's a whole bunch of nurses and nurse practitioners that are sharing ways that we can practice differently in the holistic nursing space. We have several expert speakers too that are there to support us in just like how and like legal aspects and all a lot of different topics. You can take a look at the speaker list on the fxnursing.com and you can do backslash summit if you want to check out the speaker list. But I'm really excited about that. We're like putting the finishing touches on everything, getting ready for the summit. And then during the summit and after, we'll be talking more about opening up registration for our first cohort of the functional nursing program. So that is extremely exciting. If you've been around for a bit, you know that it has been in the works for quite a while. And our plan now is to launch the first cohort of the comprehensive functional nursing program in early 2026. I will have more information for you if you aren't on the wait list already at fxnursing.com. I would go on there and go ahead and sign up for the wait list for the functional nursing program because we're going to send out email invites for people on the wait list soon to go ahead and register. And we'll have some information sessions to answer a lot of the questions that I've gotten from past students and people that are waiting at the moment. So I'll have a lot more information for you soon. I know that everybody's been waiting and has a lot of questions. And so very excited about that and everything that we have moving forward in this space. So I'm glad you're here with me. And until next time, be well. Thank you for tuning in to the Functional Nurse Podcast, brought to you by the Institute for Functional Nursing. To explore the functional nursing membership and our course offerings, developed in partnership with the Institute for Functional Medicine, visit fxnursing.com. Until next time, be well.